Wolf Kirsten with International Health Consulting in Berlin, Germany. I'm your host for today's call, and I would like to welcome everybody to, I think it's the fifth Global Consortium webinar we have of this year. Just for the newcomers, the Global Consortium for Employee Health is a thought leadership forum to assist organizations that are looking to improve their health and to enhance performance of their employees worldwide for competitive advantage, and was originally and was set up by D-Life. So today, we're actually going to be focusing on two regions of the world, which are distinctly different, South Africa and the Arabian Gulf. And one of the reasons we decided to feature both in one session is that many international corporations have identified EMEA, or Europe, Middle East, and Africa as a region for organizational purposes, part of their organizational structure. Specifically today, our featured speakers are Wandra Marais from ABSA Bank, one of the largest banks in South Africa, and Dr. Mansour Anwar from DU, a leading telecommunications company in the UAE, United Arab Emirates. So we're really glad to have these two excellent speakers and companies on the call, and I'm sure you'll find this very interesting and engaging. So to kick it off, I'd like to give a quick intro on each country. I'll start with South Africa, just to set the stage, so to say. I guess most of you will remember South Africa from the hosting of this year's World Cup in football or soccer, depending on where you come from. And not merely because of the vuvuzelas, but really because of a very well-hosted tournament. And I think it was very, very interesting, very good for South Africa. South Africa has about 48 million inhabitants. Interestingly, it has 11 official languages. Approximately 20 or more than 20% are unemployed. The life expectancy is for males around 53.5, for females 57. As you know, likely know, HIV/AIDS remains a major challenge. The prevalence of adults is estimated to be around between 10 and 11%. And with 17% of adults being HIV positive. However, chronic diseases are catching up and associated risks as everywhere in the world. So around 30% of the male population are obese and overweight, and around 55% of the female population are above BMI 25. So pretty large numbers there. And finally, just one additional, I would say, disturbing fact is that South Africa has one of the highest fetal alcohol syndrome rates, very high, especially in the Cape region. So I thought it was kind of interesting from a health perspective to hear about that. And that's naturally, unfortunately, linked to poverty and a high-risk population. But not to go on too much longer, I just want to hand it over now, kick it off. Wandra Marais is the Wellness Research Specialist in HR Wellness at ABSA Bank in Johannesburg in South Africa. So Wandra, please go ahead.
Okay, thank you for the opportunity to be presented at the forum today. I have been involved with the organization for the last 10 years, employed as an April Fool's joke many years back to start an activity program within the organization, but subsequently get involved in the bigger picture of the wellness program. And our program has been running since 1994, predominantly started as an HIV-focused program with medical aid and additional services. But subsequently we realized that we cannot only focus on those specifics, we needed to integrate the program. Now, our program is called the Little Workout Program, and our wellness mission is to promote wellness as a personal lifestyle choice, to assist our colleagues to achieve balance in all of their wellness dimensions, and then when they achieve this, naturally would contribute towards a high-performance organization. Now, very important here is promotion. It will be central in our focus, and then also wellness is always a choice. You have to make sure that you provide our employees with ample resources so that they can make that sufficient choice whenever they need to make that. Very important is we need to be there on an assisted basis. So we need to make sure that our program is extensive in that an employee will have access to our program at any given time. Very important is that we need to focus on all our wellness dimensions. We follow the 6-dimensional wellness model currently, and then ultimately when that happens, our employees will be able to fully contribute towards the high performance goals the organization has set.
Wanda, just Wolf, sorry to interject, but you can move the slides now. You basically have control. Just wanted to let you know.
Which button? Really?
You just use the arrow button,
I don't see it.
Just the arrow button you typically use to...
on our screen.
No, the arrow button's on your keyboard.
On your keyboard.
Oh, there we are. Okay, thank you. Sorry. On the slide number 3 now. Our employee team, wellness team, is 22 strong currently. This is just the baseline of our program, but very important here is our wellness champion network. We've got a wellness champion network of 1,200 employees that are peer educators, and they're actually driving the program for us within our business units. Very important function within our team. Very important is when you look in terms of the financial sector, obviously people risks are high on the agenda, and we need to make sure that we fully understand what the intricacies is in terms of our people, to understand exactly what is the people risks that we deal with any day, and then obviously we need to manage those on a daily basis. If we go to the next slide, and we'll see the history of our program. The ABSA group was formed in 1990 as part of an amalgamation of several banking groups within South Africa. We've currently got a staff complement of 36,000 employees that are based nationally, with a network of about over 700 specific branches throughout the country as well. The wellness is currently part of the HR function within our organization, and the wellness program has been in existence from 1994, although our specific components at that stage were quite scattered. And then in 2007 and 2008, the new Integrated Health and Wellness Program for ABSA was officially launched. Very important was that we strategically position our program within the bigger scheme of our organization. And our ABSA Group's vision is then to be the best service provider of financial services within South Africa and selected African markets. Our strategic themes for our organization is sustainable growth in these targeted markets, to provide a simple, streamlined bank towards that focus on customer service delivery, to make sure that our balance sheet is optimized, and then we wellness specific comes in on a people and customer centered organization. We've also got central values within our organization that we needed to align with. That said, we value our people and treat them with fairness. We strive to exceed the needs of our customer. We want to take responsibility for the quality of our work. We want to display leadership in all we do, and we want to demonstrate integrity in all our actions. When you look specifically in terms of our values, it has to underpin the role of the IHWT within our organization. When you look at our key focus areas in the next slide, in 2007, beginning of 2008, we had to introduce the Little Workwell brand into ABSA and ABSA Africa, and had to integrate it with all other relevant stakeholders there. Our focus was to increase our uptake and our impact that we have within the organization, to enhance the effectiveness of our existing services. Very important was to develop adequate data management systems, and then also to develop a comprehensive human capital risk profile. Now, when we look in terms of our wellness framework, our strategic enablers that we put in place was we had to strengthen risk focus and strategic links. We integrated all our program components. Very important was our regional integration of all our processes, the development of data management systems, and then everyone needed to understand, all the different stakeholders, specifically what their role would be within the integrated program, and then continual assessment and risk profiling. Our performance measures currently were unplanned absenteeism rate reduction of 10% per annum, 60% visibility of all wellness offerings within all our stakeholders, a risk profile reduction with increased proactive versus reactive service delivery, and an increased utilization of our wellness offerings. The stakeholders that we've identified are our employees, our dependents, our ABSA leadership team, government, legislative authorities, and service providers. And what makes us uniquely different would be the Little Workwell brand that we set within the organization. We've got a highly motivated workforce, highly supported by all our stakeholders, and then cost-effective service delivery, ultimate ROI. When we look at the wellness-phased approach, not meaning that when you finish the one phase, ultimately you'll move into the next one, but there will be all the time continual phases. Firstly, we had to start with the program implementation and risk assessment. Our phase 2 is evidence-led proactive intervention planning and ultimately integration and expansion of our ISWC into the ABSA group. The Integrated Health and Wellness Program, our service providers, essentially, we've got wellness centres strategically placed within the country, at mainly our regional offices, where there's got wellness practitioners that are responsible for the whole region. We've got ICAS. I don't know if you're familiar with International Counselling and Advisory Services. They're a company that provides us with 24-hour counselling services throughout the year, and also an e-care-based offering. We have got a physical wellness program. We've put in there, for example, the gymnasium. But the physical wellness program also deals with ergonomics. It also deals with rehabilitation, the physical health analysis process, as well as to provide physical activity opportunities for our employees, our organization. Our medical aid, BankNet, 76% of our staff do belong to this medical aid, so they're a very strategic player for us when we look at disease management specifically. And then we've got ABSA Healthcare Consultants, a subsidiary of ABSA, that consult external clients within South Africa in terms of healthcare options. And they have, they manage our absenteeism management programs for us specifically. If we look at the Little Workwell brand, we've got assessment services, we've got counselling, coaching and trauma services, we've got lifestyle management services, health management services, and absenteeism management services. And all of these ultimately must filter the information into the integrated data platform for analysis and reporting. Our service availability, for ABSA Wellness Services and ABSA Healthcare Consultants, we focus specifically on the ABSA employees. Our medical aid, we focus on employees that belong to them. And then in terms of ICAS, all our permanent employees are covered there, as well as their dependents or anyone that have that lives with you under your same roof. So for instance, if you've got a domestic worker that stays with you on site, that person will also have an influence on your life and therefore covered under the service offering. Very important is confidentiality in our program. You cannot have a wellness program without this component. Our interactions with our employees are very personal, and therefore we have to put external service providers in place so the employees feel safe when they interact with them. Whenever there's group reporting coming in, the reporting has been dehumanized, so we only get figures back into the pot so we can analyze those and create direction from there. Internal wellness service offerings is awareness programs, preventative services. We cover from family planning to health assessment. We've got primary health care within our wellness centres. Our physical wellness program that deals with gymnasiums. Biokinetics is similar to exercise physiology within international teams. We've got other professional services like physiotherapy, optometry, medical doctors, dentistry and so forth on site as well. Then EAT services, we also deal with debt rehabilitation. Of course, we're in the financial industry. It's very important that we manage that risk in terms of finances as well. So we provide our employees with a debt rehabilitation program as well as a financial literacy program. They need to upskill them in terms of budgetary requirements and so forth. We also travel into Africa, so we have got a travel medicine component. We've got bursary services to assist our employees whenever they want to study further. And then we've got a recreational club or a social club for soccer and so forth that people can join. In terms of our absenteeism management program, we've put this program together not as a punitive action. Very important is in terms of the engagement that there happens between the employee and the manager. Our program basis is for every absence that happens within the organization, when the employee comes back into the workplace, the return to work interview or consultation is held, where the manager assesses why the employee was off sick or hasn't been at work the previous day, and if there's any assistance that's needed, the employee is then referred into the specific program. In terms of our life management services, we deal with legal problems, looking from marital law to wills and estates. We provide them in terms of money management, on debt guidance and counselling, basic financial planning. In terms of family care, we look at parental guidance, medical information, basic resources, in terms of where you can find a creche and so forth, as well as additional resources, educational resources. We've also got a managerial consultancy in the federal process, where a manager could phone in and say they have got a specific problem with a specific employee, and then we will assist them through the process. In terms of our e-care component, we have got an online e-care program, very well utilized within our organization, where there's an integrated email service. Sometimes employees feel they don't want to talk on the telephone to a counsellor, but rather want to counselling via e-care means. They can also dial up there for a dietitian or an HIV specialist or whoever to get the necessary assistance. The employee then also, whenever they want to run with a wellness day or wellness information within their unit, they can pull this information from our e-care site and make it alive within the environment. Then we've got access to the services via our intranet service, as well as a toll-free line, or they can access it via the wellness centres internally. We have created our program identity. Every single employee was given this little card, and all the information about the employee wellness service are given there, and there's 2 pull-out cards, which they can leave one at home, or the other one take with them in their wallet. Our wellness service engagement per month. Currently, we had a very, very well engagement rate in 2009. This year, we're currently struggling a bit, but we're trying to keep that up. But generally, I would say, in terms of engagement, we're quite happy with our engagement rates. In terms of internal wellness services for 2009, we actually had a 63% attendance in our wellness centres. In terms of the physical wellness program, a 31.69% attendance, and then also 58% attendance on awareness programs. In terms of our external service provider, we looked in terms of our focus, in terms of responsive and proactive services, and this is where people would phone in to get assistance via the toll-free line or then via e-care service. And you will see quite a large number utilising the after professional services. In terms of our medical aid, over the last 4 years, you will see the predominantly key disease risk things that we have here, and specifically in terms of respiratory and musculoskeletal issues evident there. In terms of our absenteeism rate profile, you will see our sick leave rate specifically is around about the 1.5, 1.7% rate. Currently, I think we're doing very much in terms of our absenteeism management program. In terms of our costs, we're also containing that pretty well within the organisation currently. And then this is just the last slide in terms of our absence rates. Look over the course of the year, predominantly around about June, July in the year, we will see the rise in our sick absence rates. Thank you.
Okay, well, thank you so much, Wanda, for the really interesting presentation. I know we have some questions, but I think I would like to hold these until our second speaker has gone, just for planning and timing purposes. I know that we do have a couple questions, so please hold tight because we'll take them right afterwards. And thanks again. So let's shift and go north and maybe a little bit east to the Arabian Gulf region. And the UAE, the Arab Emirates, is our feature here. And As you may know, the UAE consists of 7 separate emirates, and you probably all are familiar with Dubai and Abu Dhabi being the most prominent and populous in the entire country. Total population is estimated around 7 or 8 million. The country really seems to be growing. And one of the most striking facts is really the diversity. And 83% of the population are expats. So that's really very interesting, I think, in terms of anything, but especially in terms of health behaviors and cultures. So that is a challenge. The UAE has undergone tremendous development and economic growth over the last decade or so, and that includes enormous strides in healthcare and healthcare infrastructure. Medical tourism actually is really booming now in this region. Very interesting. Average life expectancy is 75, so pretty high, and that's actually, I think, the highest in any Arab country. Unfortunately, this development, this rapid development, is coupled also with an increase in chronic disease. And one of maybe the most concerning statistics is that the UAE has one of the highest diabetes rates in the world. The exact figure is not clear, but it's probably around 20%, if not more. So it's obviously very high. Prevention and health promotion and wellness are still relatively new concepts, as Dr. Mansour will allude to, and are not really widely offered yet. Just one more interesting development, which I think you should know about, is the health authority of Abu Dhabi is mandating the implementation of wellness programs for all of their licensed healthcare providers, which is supposed to be part of their environment, health and safety management system. So if you're a healthcare provider in the UAE, or in Abu Dhabi rather at this point, you're going to have to implement some wellness programs, and there's some more details around that. But I think that's interesting because I'm not really aware of any of other healthcare providers globally, in other countries which have to do that. So, but I'll leave it at that, and would like to invite Dr. Mansour Anwar, who's the Director of Medical and Occupational Health Services in Human Resources and Shared Services at DU, like I said, large telecommunications company in the country. So, Mansour, please go ahead and Barry, hand over controls, please.
Thank you, Wolf, for the introduction, and I would like to welcome the panelists and all of the attendees at the moment from every part of the world, and a very warm regard from the city of Dubai, from the country of United Arab Emirates, to everyone. As Wolf mentioned very briefly, we are made up of 7 emirates under one country, and the 2 main cities or emirates which are very famous is the capital, which is Abu Dhabi, and the trade hub, which is the city of Dubai. And I do come from the city of Dubai, but from the United Arab Emirates as an Emirati. Going directly into the concept of wellness and health promotion and the whole issue about it, yes, indeed, it has been at its infancy. The things has been just picking up recently because the country has got its independence 40 years ago, and the whole thing was mainly to establish an infrastructure of health with a good number of hospitals, primary healthcare centers, and with the financial boom, with the multicultural picture that we have in the country, as Wolf said indeed correctly, that we have more than 80% from different countries residing in here, has brought to us a challenge and an interesting and an amazing blend of cultures in one country, and in specific in the city of Dubai, where most of the different nationalities reside. Without further delay, I would go and start into my presentation. I used to work for 9 years at the government for the healthcare sector as being a specialist family physician, and then I got into my occupational health specialty, and since 11 months I have moved to the telecommunication industry, to the Emirates Integrated Telecommunication Company, which has been known and branded under the brand of DU. And it's the second telecommunication operator after the main operator in the country, which is Etisalat. So it has been a story of success for the company since it was launched in 2007, and within a period of 4 years, they were able to take hold of 35% market share of the mobile industry, and they are striving for better and better. And as part of their enhancement, they have taken the lead to introduce the concept of wellness within the organization and to have an in-house clinic. And for that purpose, I have been privileged to join the company 11 months ago and to establish something along that route. So it has been a very new concept.
Can dash the slide, just to let you know.
Sure. Okay.
Just use your arrow on your keyboard, or
I'm trying to make a move for that one. Yeah, here we go. Okay. This slide represents the main pillars of wellness that has been looked into as soon as I joined the company, because there was no wellness program whatsoever at the company. There was no medical facility, no health-related facility, except for the usual campaigns and stuff like that. So we had built our whole concept rounded along the path of prevention and lifestyle. And when I mean by prevention, it's the medicals in terms of preventive and therapeutic services, and then we have the vaccinations and the drugs. And I'll come into further detail down the presentation line. And in the lifestyle pillar, we have the nutrition, we have the physical activity, and then we have the stress, sleep, smoking, and alcohol. I will come back to this slide again in my presentation to talk into more detail about it, but I would like to take you into a very quick tour of what is happening at the moment in the company and where we have reached in the last couple of months since I joined the company, and the further key performance indicators and enhancements that we are looking for in 2011. So, as mentioned earlier, in the preventive pillar, we are looking at the appropriate medical investigation, recommendation as per the age and the risk factor, vaccination and travel-related immunization, medications, vitamins, supplement, advice as per the age and the other risk factors. And in terms of the lifestyle pillar, as mentioned, is the healthy nutrition option, physical activity requirements, obesity assessment, smoking and alcohol assessment, work-related stress management. I'll come back to that slide again. So, let's start the story. The clinic has gone under construction, and we started gathering all the tools and the needed approvals from the different regulatory authorities, and we were able successfully to launch the clinic softly in May, which is a few months ago only, in the main headquarter, because we have 2-3 premises for the company. And when I mean by a soft opening, it was a soft opening in the sense of that we did not have the full functionality at that time. But nevertheless, we didn't want to delay the project, and we went ahead and we started creating a medical health file for every single employee. By the way, the company is made up of 2,000 employees, and the most beautiful, challenging part of the equation is the multinationality factor that we have in the company. We have more than 64 nationalities. As we like to call it in the company, we are the fruit salad of the city. So 20% of the company is comprised of the local population, the Emiratis, and then we have 16% from India, 14% from Egypt, 12% from UK, and 10% from Australia. And we have different other countries from the Europe, from the United States, from South America, South Africa, North Africa, and you name it. The official launch happened in November 2010, and that's just last month, and that was the good news. And since then, the employees were so excited for that good news, because for them it is very weird to have a clinic in an organization other than the healthcare industry. Whenever I come across an employee, the first question says, what a doctor is doing in the telecommunication industry, and the usual slogan we use is that we are treating the mobile phones, as a side joke. But nevertheless, yes indeed, I mean, the employee started feeling the benefit of having that in-house clinic, although we are providing a medical insurance cover for every single employee, the family member of that employee, the spouse, as well as the children, unlimited number of children, and that medical insurance scheme has been going since 3 years, since the start of the company. Nevertheless, just having the medical insurance scheme itself sometimes is not the only option, because we have more than 220 clinics and more than 20 private hospitals down the road in addition to the government sector. So there are multiple options down the road, and sometimes the employee are bewildered in choosing which is the best option in terms of accessing the healthcare sector. So we're looking into adapting the family medicine concept, as they call it in the United States, or the GP concept in UK, where you have the GP of the neighborhood and everybody goes to him, where he will refer if a referral needed. Otherwise, the GP will be able to treat the illnesses. As I do carry the international membership of the Royal College of General Practitioners and the Arab Board in family medicine, as well as the Master in Occupational Health. Nevertheless, we have given the option for the employee to access any other healthcare facility at their pace at their interest and at their choice. And to enhance the clinic services and to sell ourselves better internally, we have created an intranet webpage, and that's a glimpse of the intranet webpage that you can see in front of you, ladies and gentlemen, where we are providing different services in there, such as just a small introduction about the clinic, and we do update the intranet website with regular medical articles, medical tips, health-related information. And one of the very successful campaigns that we have was during the month of Ramadan. As you know, in a Muslim country, we have the month of Ramadan where people do fast from dawn to dusk. And what happened is that during that month, for 30 days, which fell along the month of August in 2010, we were sending a health tip every single day for 30 days to each single employee on their cell phone, on their mobile phone. And that had a tremendous positive feedback in terms of trying to address the different issues and factors related with fasting, and also utilizing that opportunity to adhere and to address the chronic illnesses that is one of the main burden, as Wolf mentioned earlier in his introduction, that we are being challenged and faced with. Thus, the preventive services which is being provided at the moment in the in-house clinic is vaccination, and that encompasses mainly the vaccination which is needed if you want to travel to different parts of the world, as well as immunization plans for the children and members of the due employee, their family member. And then we have the travel advice in terms of whatever needed for those business travelers, executives that we have that would need a sudden travel to different parts of the world, and what would be a good package of certain simple medication to take further along, or if they are suffering from chronic illness, what would be better for them to do or to have indeed in advance, and to be ensured that they are in a good state of health. Screening for obesity, diabetes, and hypertension. And this is one of the main important pillars and focus as having the chronic illness. As Wolf said, yes, indeed, we have around 20% the diabetes rate, and likewise the obesity is around 18%, and we've done a study among the school children 3 years ago, and it was about 14%, which was considered at the top ranked countries in that perspective. And with the diabetes and with the obesity falls in the hypertension. And at the moment, what we have done, we have recruited a nurse as well in the clinic, and we are going down to each single employee. We are approaching them rather than waiting for them to visit the clinic, and we are carrying with us a bag where we do measure their height, their weight, find out their body mass index, look at their glucose level, and look at their health style, look at their nutritional profile, and to have at least a database to start within and to look how can we address these issues further, because we were planning to have plenty of different health programs, but we thought first, let us find out, do we really have these issues in the company before making any assumptions? And that was the reason why we went ahead and we started compiling a health file for every single employee. And the good news is that we were able also to secure one of the vendors down the road which implemented an e-health file system into the company, and that is being under training. That's why I couldn't give you a snapshot of it, because hopefully by next week it's going to be launched officially, and we will be able to use it for every single employee to have their health details, their medication profile, their illnesses, their family history, every single thing under one roof and under one file without using any paperwork for that. And that's another achievement that the company are really proud of, to start off with an e-health file system from the beginning. Coming to the therapeutic services, being a family physician and being able to treat different illnesses and manage, let's say, in a broader perspective, different sort of illnesses, and we do take care of managing acute illnesses such as common cold and flu, tonsillitis, migraine, back pain, musculoskeletal issues, whatever comes in mind in terms of acute illnesses. Yes, indeed. Also, we do look after the chronic employee that we have who are suffering from diabetes, from hypertension. Even we were able to spot many new cases of hypertension and diabetes which were undiscovered earlier, and we were able to have a mutual agreement, and we came to common ground of understanding for them to start lifestyle modification. And for some of them, where they were ranked at a high risk, they started medication with a follow-up plan with the nurse, and to ensure that certain investigation also has been done to find out if there is any other risk factors that has been creeping along. In addition, any complicated cases that needs to be referred to a specialist in that specific field, we do offer that as well. From the network and from the humble experience that I had with the different healthcare providers down the road, we do give them a couple of options, and it's up to the employee to visit one of those options and to give us a feedback so that give us a consolidated look into the credibility of the healthcare provider versus the commercial aspect of the equation. And we have provided something which is out of the box in the city, where we are delivering for free medication up to the employee's desk. So if in case an employee needs a medication, then there is a free delivery of the medication through collaboration with a couple of pharmaceutical vendors around the city, where it is covered by the insurance, and we ensure that the employee comes out totally comfortable, and that has really impacted the employee engagement, because we do carry on a yearly basis a survey which is being handled by Gallup, a well-known company, and to look into the employee engagement, and we are carrying one again this year, and the results are going to be early 2011, and that has impacted employee engagement like anything, because for many of the certain nationalities, for them, the chronic illnesses and the hassle of going down to their doctor and going through investigations and getting the medicine and waiting for the queue was a hassle. So by having this just one or two floors above them or below them had made the life easy for them. And that gives us the opportunity to catch up with them and to discuss with them other lifestyle issues, their work-related stress, and to tackle that opportunity for counseling and for allowing them to express whatever they are looking for and they are seeking for from a biopsychosocial approach, because from a family medicine context, we do have a mutual adult-to-adult conversation with them, and where we allow the employee to explore and to express himself in a friendly atmosphere, and to ensure that whatever is the hidden agenda to be uncovered and to be taken further, because that's one of the key factors of success of any outcome. Health promotion, that's one of the important pillars as well that we're working among. We have started humbly during the last few months. We've conducted a good number of campaigns about smoking, about work-related stress, and about the concept of occupational health and risk assessment, because this concept is fairly new in this part of the world. Many people are much more involved with health, safety, and the environment, the HSE, but occupational health, as in its context of the impact of work on health of the employee, has been very new. In addition, we've utilized the month of November, which is the Pink Month among the world for the breast cancer screening awareness, and we have secured a discounted rate to conduct a mammogram for those employee and spouses of members who are 40 years and above from a couple of healthcare providers and hospitals down the road, and we've distributed those vouchers to the employee, and that had an overwhelming feedback from the employees. That the most important thing what came across is the feeling that they are being valued, that they are being taken care of, that there is somebody that looks after them, and that has also impacted the picture of HR in their mind. Some of them used to look to HR as the policeman. Now they're looking to the HR as the caregiver, as the father or the mother that will look after them when they are at a point of weakness, or even when they are healthy and they would like to just talk about anything. They're most welcome, because we have a dedicated floor where we have called the HR Service Center, where the employee becomes the customer in that floor, and he is dealt in as a customer, and he's been privileged with anything that he needs, and we try to please them as much as possible and to get their feedback as well, how to enhance our services in a continuous manner. Sickness absence management, in a very quick nutshell, we are doing analysis of the reports at the moment to look at our rates, and then the post-sickness absence fit for work evaluation as well as being done. Appropriate work adjustments has been investigated for certain employees who needed that, and ill health retirement support is also there for those who are totally unable to perform their tasks from functionality perspective rather than just from the physical disability perspective. And I would like to take the opportunity here and to share with you a story of success with the approval of the guy that you see in front of you in the picture. He had gone through a stroke, and he had gone through a 6-month rehabilitation program, and most of the employees lost hope on him being able to come back to work. We believed in him. We took him back again, and we have started with him with work adjustment, with a graded work return, and we were able to bring him back in, and with his passion, with his motivation, and with the management belief in him, and with the support of the HR, he now is able to be, he's fully functional. Nevertheless, he's following up with his physician in terms of the physiotherapy and all the other modalities, and we are ensuring that this story success has been shared to every single employee to ensure to them that you are being valued as a human being before anything else, and it's not just about your productivity factor, which matters. Thank you.
Excellent. Thank you very much, Mansour, for this excellent presentation. I think it really shows that DO is a very innovative employer if you consider the region, for those of you familiar with it. So let's go for questions. I think I know that Dean Patterson from Unilever had one for Wanda. Why don't we kick it off, and then let me just say that whoever else wants to ask a question, please use the raise your hand function, and Barry can unmute you. So Barry, you wanna start with Dean?
Sure. Well, Dean typed his question along, and he wanted to know if how much the absence rate has dropped since 1990, and that was actually sent during Wanda's presentation.
Wanda, do you want to respond to that?
Yes, I can respond to that. Unfortunately, I wasn't at the organization in 1990. What I can do is, we have got statistics in terms of our absenteeism rate from about 2005, and it seems to be, in terms of sick absence rate, pretty stable between 1.5 to 1.8% sick absence rate. We actually do suspect that there would be a slight under-reporting in terms of sick absence within the organization, and therefore we implemented the return to work interview process. And we eagerly looking forward to seeing a trend drop in that.
And let me ask you, what are the main reasons for sick leave, main factors at this point?
Our sick leave specifically is in our organization respiratory related, specifically around June, July, with flu, the common flu. Headaches in our organization also being and stress-related factors.
Okay, so stressful. Okay, good. All right, Barry, you have another question somewhere?
There's no other questions at the moment.
Okay. I want to encourage you, all of you, to ask questions to these two really, leading examples. But let me ask a question for Mansoor at this point. Mansoor, do you think, given the really concerning chronic disease situation in the region, why do you think not more employers are taking a more proactive approach around this, like your company? What do you think? What do you think are some of the reasons for stopping them to do that?
One of the important factors, Wolf, for that is at the moment the assumption among most of the organization is by securing a medical insurance coverage for the employee and the family member would be sufficient enough to fulfill their agenda or to fulfill their responsibility in terms of securing a wellness pillar for the employee. Nevertheless, nowadays the different organizations have recognized it's not just about the medical insurance coverage, it's more than that. And we are trying to spread whatever experience that we have gone through to every single different other organization, because we believe that we are all in the same boat as a city, as a country, and we would like to spread our story to every single inhabitant in here to give them the impact that it is so beneficial and it's not just another burden or another cost on the employer, because that's another, which leads us to another factor that many of the employers think that having an in-house clinic is a burden and it will lead to a labor cost, and there is no need for it because we have plenty of hospitals and clinics down the road, so why to have an in-house clinic? It's not just about the treatment of a medication as per se, that's just a very small facet of the whole picture. The bigger picture is the wellness, it is the feeling of security that the employee feels when he sees such a service being delivered to him on a daily basis.
Excellent. Yeah, thanks. So I assume that you indicate that you foresee some additional growth in this field, that more employers will address this, right?
Yes, indeed. Yes, indeed. Many of the organizations have taken this a step further. Some of them started just with subscription to gyms and to different nutritional counseling services as a startup point, but the company liked to take a step further by having the fully fledged picture, and even now we have secured a partnership with a personal trainer gym that will be providing their facilities and their services to our gym, which is located on one of the floors, and as well as we were able to collaborate with one of the healthy nutrition service providers, and we are also down the pipeline to collaborate with one of the very well known, established, esteemed companies in terms of health promotion and to give that accessibility to every single employee.
Okay, very good. Yeah. Any questions? I can't really tell, Barry. Are there any others?
None so far. I have sent a chat request to the participants to say that if they have got a question, they can either click on the raise the hand icon within the console or by typing their question in the Q&A section of the WebEx console. Okay.
Well, I could ask many questions. Let me ask another one to this time to Wandra. Wandra, we just talked a little bit about the absence rates and reasons. What about, because they were pretty low from the statistics that you showed us. What about productivity? Is that something that or presenteeism, is that something you're looking at, or do you feel you have a good view of presenteeism or productivity?
No, that is part of our actions for next year to look specifically in terms of presenteeism rates, and also we're researching currently specific questionnaires to assist us with that. currently we work on an assumption that our absence rate will be influenced by 4 times, or the presenteeism rate will be about 4 times our absence rate.
Okay, yes, that's, again, I think that's a universal issue. At least wherever a presenteeism has been measured, they find some kind of number, multiple factor in terms of impact, in terms of health regarding productivity. That's the case. I have here, I just see a question, I'm not sure who asked it, but, and who is it for, but how can you convince the employer to pay for wellness when you have all employees have national health coverage? I assume this may be directed to Mansour, giving his comments early on.
Thank you for this question. One of the things that we looked into, yes, indeed, we have a cover for every single employee from a medical insurance perspective. But what happened is that the employer looked into it from the perspective is that just having the cover by itself would not serve the purpose, because it will keep the employee doing a medical shopping, as what we call it. Because if there is, just for example, if he has an issue with his eye, he might need to go to a couple of healthcare providers until he would be able to find out which one would be the most suitable in terms of management and communication. So we tried to shorten that path by initially looking into that and managing that internally, and if it didn't work out, then we would try to shorten that and reduce even the cost on the insurance coverage by giving him a couple of options, so that rather than by the 5th station, he will be able to get to the desired best practitioner by the 2nd station, or even from the 1st station.
Okay. That was... Sorry, do you have some additional comments? Sorry?
Yes. So, I mean, the thing is that as we started only a few months ago, so maybe in another year's time, there will be more consolidated data about the impact of this assumption and whether this served the right purpose that we are aiming for by figuring out our claim analysis by next year and our sickness absence reports, and collating both together to find out if that really impacted the way that the company is aiming for.
Yeah, okay. I think it's interesting what you also said earlier in terms of the engagement, the well-being, and kind of the feeling of taken care of. That's really resonates in Europe or in other regions too. So it's very interesting to see some of those common factors. So they're very important. Do we have any other questions at this point, Barry? Are there any?
No further questions.
Okay, well, we're getting close, so that's for sure. Okay, well, I think if nobody else has questions, first of all, again, I would like to thank our speakers very much, Wanda and Mansour, for joining and really showing some excellent data and giving a good story. So I think it was very useful. Of course, I'd like to thank everybody else for joining. That's very good. As usual, you will be sent an update or a follow-up afterwards with a link to the session, as we can see here on the screen right now. And also, I usually ask for your input, your feedback, and also in terms of future sessions. Like what topics are you really interested in terms of the global scene, the global arena. Which countries or regions do you would like to hear more on or more from? I think that's always useful for us putting these things together. So thank you very much again, and wish all of you great holidays and a really good start to the new year. And I'll say goodbye from Berlin. See you soon.
Thank you.
Thank you.
Thank
Bye-bye.
you very much.